Dear friend, I am Dr. Anwarul Haq from Mangrahat. I share with you the case simple fever of homeopathic some medicine. First, aconite. When I use, when we see after case taking, the cause is from dry cold wind. The cause is from dry cold wind, high fever with sudden onset and violently, skin dry, hot with great thirst and restlessness, with anxiety and tossing about, with anxiety and topping about. Bryonia alba. When I see the symptoms after case taking a patient, the mouth, lip, tongue, even stool and cough is dry. Mouth, lip, tongue, even stool and cough dry. Great thirst of large quantity of water at long interval. Constipation and backache present. Wants to lie quiet and perfectly still as motion aggravate travel. Belladonna. We can use if these symptoms are present. Burning hot, smoldering heat with sudden onset, rapid raise of temperature, throbbing headache, flushing face, red, hot eyes, feet cold and sweat only covered parts, sleepy but cannot sleep, no thirst, fever due to overheating or exposure to sun. If in this case we must use belladonna. Then we go to arsenic as a patient. When fever with thirst for a small quantity of water frequently and at short interval, very rapid prostration and weakness out of all proportion with fever, simple fever, very chilly at the outset but later as if blood was boiling within. In these symptoms, we can use arsenic. Then we go to Marksall patient. When we use chilly and hot alternately, creeping chilly, particularly in the evening, copious salivation, profuse sweat at night without relief, tongue flabby, soft with imprint of teeth, Pulsatilla, simple fever. Pulsatilla patient, simple fever. We also see these symptoms. Mouth and lips dry, yet the patient is thirstless. Constant chilly even in warm room. Taste bitter. Rose the fever in the evening time. Then I go to Rastock's patient. The causation is due to cold and rainy weather. From getting wet, body pain present with great restlessness, changing always his position, often. Gelsemium, simple fever, we see when languid and semi-stupor condition, wants to be quiet and alone, does not want to speak anybody near him, drowsy, body pain particularly in the back of the neck when fever is coming. Nux vomica patient, simple fever. Burning hot, still wants cover very chilly, even least motion brings on shivering, obstinate constipation, fever between 10 to 11 am. Fever between 10 to 11 am. We can use epismel when we see the skin sweaty and dry alternately. Sweaty and dry alternately. We can use ipecac when we see the patient where nausea and vomiting are main symptom. Where nausea and vomiting are main symptom. Suriname we can use in simple fever. When fever with intense heat and boiling, profuse sweating. Phosphoric acid also a simple fever we can use when low type of fever, very obstinate and chronic condition. Very obstinate and chronic condition. Thank you for my listening this video. Thank you again.